Good afternoon, guys. I hope we're all sparkly. Now, it will come as no surprise that testosterone is involved in mental well-being, because men who present with low testosterone often have an element of low mood, anxiety, and/or depersonalization. This feeling that you're present but not present, or involved in the moment. And it's all about the moment, being fully present in the moment. In psychology, they talk about the felt sense. Now, that's the appreciation that this upholstery does feel nice. I feel slightly suffocated in here. The window should be open. I need to get some fresh air. I need to be aware of my surroundings. Because when you're aware of your surroundings and you've got healthy androgen levels and a sense of perspectives that is helping, not hindering, you can move forwards. You can fully assess the situation, understand your part. What is your part? Okay, so we've always spoken about mind over matter, and psychological therapies that manage mental health disorders have concentrated on this mantra. Now, we do not believe this mantra to be true, and we do not believe that this will affect a positive change unless you consider matter over mind. One of my guys gave me that phrase. It's incredibly important to address causation. Without addressing causation, you cannot affect a sustainable change to your physical and psychological well-being. You cannot be healthy in mind when you ignore physiology. We place too much emphasis on psychology. And where has that got us? We are a species that actually truly believes it is better to end our lives to find a semblance of peace. How incredibly disturbing is that fact? We voluntarily terminate our lives to end our psychological suffering. Now, there are numerous causes for psychological suffering. There are too many to go into. However, as you guys know, we are now working with veterans who have TBI, traumatic brain injury, and complex PTSD. These guys have a neuroendocrine dysregulation as a result of the polyvagal theory, so sympathetic overload, suppressing the natural response to a life-threatening event, which is initiation of the dorsal vagal nerve, which subsequently results in dysregulation. I've said it before, and I'll say it again. We are so far removed from nature, our physical and psychological well-being is at stake. At the ever-rising incidence and prevalence of mental health within our society, something is incredibly wrong with this model. I said it in the last video. We are conditioned to be robots, to be part of the machine, not understanding our true place within this world, within this universe. It is incredibly disturbing. We need to go back to nature. We need to use our knowledge of science, history, incredibly important. Learn, adapt, and progress. Because the machinations of the machine are not here to help you. They are here to feed the machine. To change to the collective without first looking at the individual, but realizing that the collective is what's important. Deep, hey? But it's incredibly important. So let's go back to hunter-gatherer days with our understanding of science, nature, lifestyle, nutrition, and physical exercise. We are physical beings in a world full of psychological stress. We should be able to cope with stress and go through the normal physiological mechanisms, but we suppress every single urge because we are civilized. There's not much civilized about this world right now. We're living in a time of misdirection, superficiality, and we're all complicit in the game because we don't understand the importance of looking inwards. We don't understand the importance of this very moment right now. And as Russell Brand said, time is infinite. You cannot run out of time. Time is infinite. And we need to appreciate that. We need to live in the moment. If you live in the past, you're going to be depressed. If you live too far in the future, you're going to be anxious. I'm guilty of it. Lots of stresses, lots of strains. What makes me happy is living in the moment, being fully present. Need to address causation. Low testosterone is a cause of depression, anxiety, and depersonalization. It is not a fix-all, cure-all solution to the problem, because we need to have a holistic approach to how we treat mental health disorders, looking at causation, lifestyle, nutrition, exercise, then hormonal health, then modern medicine. Psychological therapies will only be effective if we have had a look at this model and shown due diligence, not reaching for that prescription pad and prescribing antidepressants when we don't know what the cause of depression is. When we have antidepressants, you flood your brain full of serotonin, which is the pleasure chemical, where's the happy chemical. So you should make an argument, well, I want to be happy, so I want to flood my brain. You must recognize that we are in nirvana right now. And if you distort your physiology through medications such as antidepressants, you lose the ability for contrast. You should be able to experience highs and find joy. You should be able to experience lows and hopefully learn from them, or at least find some peace and move forwards. Because life is a journey. You are the master of the ship. It is incredibly important, guys. So we place too much emphasis on drugs, psychological therapies. When we're born, we're a blank canvas. We are physical beings. We have genetic code. We have exposure, nature versus nurture. Fascinating. We need to concentrate on nature, understanding nature to help facilitate nurture.